podcast, like, because the software I use, you have to stop it and then you have to let it upload. So there's like the fake goodbye and then there's the real goodbye.
Right.
But between the fake goodbye and the real goodbye, when we're not recording, it's the best.
The best, yeah. And you can't
It's
say
like-
anything. You can't use it. Hello, everyone, and welcome to the first ever episode of our newly rebooted Global Veterinary Surgery Podcast. And I'm your host, Dr. Jolle Kirpensteijn, and I could not be more excited to kick things off with a bang and a whole lot of wit. Joining me today is none other than Dr. Sarah Boston, world-renowned veterinary surgical oncologist, author, advocate, and yes, stand-up comedian. We'll be diving into the wonderful world of surgical oncology, chatting about how cancer care is evolving in veterinary medicine, and maybe poking a few well-timed jokes at our expense. We'll also talk about a recent petition that has been making waves, what it's like to be a proud Canadian in a world that sometimes forgets Canada is not the 51st state. Sorry, and how we both prepare for those big, nerve-wracking keynote presentations. Spoiler alert, caffeine and a mild panic may be involved. And as always, you can find this episode on all major podcast platforms. And if you want to see us in action, the video is on our Global Veterinary Surgery YouTube channel. Don't forget to check out our website, globalveterinarysurgery.net, for more info, show notes, and behind-the-scenes goodness. All right, let's get into it. Scalpel, please. Hello, I'm Dr. Jolle Kirpensteijn. This is the Veterinary Surgery Podcast, and this is the first one after a year of nothingness, complete nothingness. And I apologize for that because it's all my fault. There's only one person that you have to blame. It's me. And so that's what you have to do. But I'm back now, and I'm back with an amazing guest. There's a couple of things that we have changed. You know, it will be on the Spreaker again. So the podcast will be on podcast, but we'll also be on YouTube. And that's why you have video. And, I am so proud to have my first guest being Dr. Sarah Boston. Hey, Sarah.
Glad you're back.
Yeah, I'm back. Just to be honest, I was never gone. So I was not there, but I spent a lot of time with the other podcasts that I had, so I ignored my surgery friends a little bit. And the interesting thing is, you know why I'm restarting it?
Pourquoi?
Because I was at a conference and there was this young person coming to me and she said, "Oh I can't believe that you stopped the podcast. I am doing a residency and I love the podcast because it helps me. I have to drive a lot and I listen to you. Your voice sounds very soothing."
It's the accent.
And so she said, "I can't believe that you stopped it." And I'm like, "Oh, what excuse can I use? What excuse can I use?" And there is no excuse.
Well, there is. I mean, I have a podcast, so just a lot of work.
It is a lot of work.
There's
Although I do
listening.
I have to say this is a minimalist podcast. So whatever you say is not going to be cut out. I don't use any AI. It's all real. It's raw.
Okay.
It's raw.
Okay.
I hate raw, but except for podcasting.
Okay. One question.
And sushi.
If I, because I'm in Canada.
Right.
And we swear a lot more here.
Right. No, it's raw. I mean, you can do whatever you want.
It's raw. Okay.
Podcast allows anything, except not being inclusive, not being diverse, and not having any equity. Anything else is allowed.
Hey, I'm in Canada, man.
Right. Yeah, and sadly, I am in the US, although not sadly, I love it here. But, the political climate is nowadays a little worrisome, to say the least. But we're not going to talk about politics, maybe later. First, Sarah, I'm really happy that you're here. Can you, for my podcast, audience, can you tell a little bit about yourself, what you're doing, and why you're here?
Okay, I am a veterinary surgical oncologist. I have worked in academia and private practice. I've been in private practice now for 8 years, I think. And what else? I don't know. I have ACVS surgeon fellowship in surgical oncology and oral maxillofacial surgery, although founding fellow. And now I work at a very nice hospital founded by our colleague, Julia Sliptak, and it's in Ottawa. It's called Capital City. And I work there 2 days a week. I do like around a 60%er.
Right.
Because I do a lot of other things now. So I love that. So I do comedy, podcasting, writing, stand-up comedy. That's kind of my passion. So that's what I do on the weekends. And then I work at the beginning of the week.
And that's all these things we're going to talk about. And we need to get Julie's on this podcast too. I decided to change this podcast a little bit because it used to be only articles. Now I'm going to interview some people too. But we're still going to talk about articles and science and that sort of things because it is the veterinary surgery podcast. So we need to talk about veterinary surgery in general. So next to that, Sarah, you are the inventor of the Boston Plasty.
Thanks for calling it that. Yes, I think it's underrated.
It is underrated. I agree with you.
I think it's very underrated. Okay, if you don't know what the Boston Plasty is,
shame.
Hey, first of all, shame on you. Second of all, veterinary surgery was like, you can't call it that. And I was like, why not? And they were like, because. So, okay, it was inspired by the Von Ness or the rotation plasty, which is a procedure they do for children with osteosarcoma when they have a distal femoral osteosarcoma.
Right.
And it's very difficult if you have an above the knee amputation. It's very difficult to fit a prosthesis with that. So what that procedure is it's a resection of the distal femur and proximal tibia, but the neurovascular structures are preserved. And then the ankle is rotated, basically, the distal tibia is rotated 180 degrees and it's plated like that. So your ankle becomes a de facto knee joint. And why that's really important is they can kind of do these crazy calculations for how much growth, how much the kids are going to grow. And they end up with the ankle/knee the same level as the other side. And then they can fit a prosthesis because your foot pads are made to step on things. And so it works better. And so, so I was really fortunate when I was faculty at University of Florida, I was able to observe one of those procedures, which was kind of mind blowing for lots and lots of different reasons. I learned so much just watching that. But then it just got me thinking about our distal radial osteosarcoma in dogs. And every single procedure, pretty much for limb spare, pretty much every time we're resecting distal radius and then we're like putting something in, whether that's
something
bone, dead bone, piece of metal, 3D printed thing, like it's always and the problem is that never heals. Like these dogs live about 10 months. It's never going to become, even if it's bone, it's not going to become incorporated. I guess except for the ones that had, the ulna that was alive.
Right.
But anyway, vascularized grafts that I guess you could argue there's always exceptions to what I'm saying. However, I was like, well, why can't we just remove it and just do a carpal arthrodesis? That just seems like, a lot simpler. And then there's not this big hunk of whatever sitting in there. And then the limb length, there'll be some discrepancy, but there was some horrifying studies done in the 80s where they like shortened dogs' legs. Don't read them. They're horrifying. They did not give them a lot of good analgesia. But in those, we have to use the knowledge from those studies because animals suffered for those studies. And the dogs can tolerate a 20% discrepancy in limb length.
Right.
And if you do the carpal arthrodesis so that you don't bend it, the plate at all, it's just completely straight. And then you think about how older dogs have some carpal hyperextension. That actually takes out any discrepancy as it is, if you think about it, because this dog that is in the paper that I wrote, my wonderful fellow, Owen Skidder, who's also amazing.
We need to get him on too.
We need to get him on. So if the dog was like lying on its side, the legs were different length, but as soon as then standing up, they were like the same length. So the idea was we would fit the dog with a prosthesis. And we did that, but actually I don't know that you need to, because some dogs will just adjust with either just the change in the carpus that kind of evens things out, or they just learn, they'll just extend their shoulder more on one side. Because dogs are amazing.
They are amazing.
So that's a Boston Plasty. Check it out, everyone. And
yes.
Also, I think like a lot of surgeons are really good at carpal arthrodesis, honestly, probably better than me.
Right.
So the other thought behind this is to make this more accessible to other surgeons so that and also a little less expensive. So There you go. That's the Boston Plasty.
That's the Boston Plasty in like 3 minutes. Everything you need to know. And if you want more information, it is all in that article. That's probably not the article that you would choose, because I will ask you what's your favorite article and why. But, I think it is amazing. And I think too few people are using it because they probably don't know about it. So check it out. Check it out. Right. So, Sarah, one of the reasons that I wanted you to be my first guest was keynotes. We were talking about keynotes. I have a keynote at the Veterinary Surgical Oncology Society and then I was talking to you about that, and then you were saying, oh, I have a keynote too. So I said, oh, that's really cool. Let's talk about keynotes and how we prepare for them, et cetera, during the podcast, because it doesn't happen that often. I have complete imposter syndrome here because, suddenly you have to stand in front of all your peers and you have to talk about something that, you know a little bit about, but the pressure mounts, although people are really, really nice in the Veterinary Surgical Oncology Society. So they will never do something. They will never boo, except for Bryden Stanley, who probably will be in the audience too. But, most of the people will be really nice to you. And the reason that Bryden is going to boo is because she had a keynote at ACVS and I had the audacity not to come. So she will never forget that. And she's holding that against me for the rest of my life, and rightly so.
Yep. Fair.
So tell me a little bit about your keynote, and that has a twist. I can tell the audience already that. And how do you prepare for a keynote? And, do you have imposter syndrome too?
Okay. I have a few keynotes on the go.
Ooh, you are hot.
I do. I have one about failure.
Right.
Because I think and I actually have a failure bio that one day I'll be brave enough to give that to someone to read, because all of the bios, when you get up to speak, they're like, Sarah Boston, did this, blah, 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 boarded.
She's awesome.
Be like, Sarah Boston failed her California boards. Sarah Boston didn't get a residency right away. Sarah Boston got fired from her first job in general practice. So I think that's more interesting. So I think it kind of fits into imposter syndrome, but I don't think we talk about failing enough. And then we have people we're mentoring or students we're mentoring, and they just think that we just boom, oh, I'm a surgeon, everything's so easy, I just did that. And it's not true, and it's not real. So I love that keynote. And then I have, because I do comedy, I have...
Okay, before we go to the comedy part, I just want to respond to this, because you are so right. I was prepared. So first, I knew that I had this keynote 1.5 years ago. And I said 1.5 years ago yes to it, because normally I don't say yes to a lot of speaking engagement because I'm so busy. I said yes to it because I have 1.5 years to prepare. I know I will get this. I need to prepare for it, etc. Now the keynote is in 3 weeks, and I'm at the same location. So
weird how that happens, isn't it?
It is. I don't know why it is. I had 1.5 years, and I just.
But you've been thinking about it, so I wouldn't
Yes,
what
that's
I mean?
True.
It's because I find when I'm trying to prepare a talk like that, yes, maybe you're kind of rushing it, but you've been thinking about it. So the other so I have a keynote about humor and resilience and humor, because that's something that's really, really important to me. And then the one I'm working on right now is about cats.
A keynote about cats.
Yeah, but it's really about, so I was going to I was just at the student AVMA symposium.
Right.
And I don't know if I even told you this, they asked me to be a keynote, and everything, all the emails were keynote. And then my contract was keynote.
Right.
And then the week before, Bill Culp, another amazing surgeon at UC Davis, he messaged me. He's like, hey, Sarah, I'm coming to your set. I was like, oh. I'm sorry, what? My set? And then I went back, I talked to the students, and I was like, do you guys want me to do stand-up? And they're like, yeah, we want stand-up. And I was like, oh. And then I talked to actually Dr. Jandry, who's a criticalist at UC Davis, who was helping with the symposium, because I was like, I want to talk to some administration.
Yeah.
I talked about you. I was like, I did something for the Hill Symposium, and I said the word vagina, and I don't think Yola was very happy about it. I was like, how are you feeling about this? And Carl was like, no, it's okay. But I was like, stand-up can offend people. And then it was funny because Carl was like, well, I just don't like when people make fun of clients. And I was like, but Carl, someone's not going to like that I said fuck, and someone's not going to like that I made fun of clients, and Jolle didn't like that I said vagina. Like, do you understand?
I didn't mind the vagina, by the way.
I know, but it was corporate, and you're like, oh, Sarah, did you have to say that? And I was like, oh, I don't know, but it was clinical. It was like, anyway.
Right.
I'm just saying there's always going to be something with stand-up. That's right. Because it's stand-up. Like, unless you're going to be the most boring, like, you're going to be like, client be, I've been listening to the chest and client be talking, like that kind of like, that's like the airplane food of veterinary economy. So like, I don't do that. So anyway, I was preparing this keynote about cats because it was like stories. It was like stories from like when I was a vet student and then when I was an intern, and like things that have happened that actually are pretty unfair and pretty upsetting. They always had to do with a cat, and they always had a good lesson about like being true to yourself, being true to your ethics, or always focusing on the patient. Like things that have been my North Star through my whole career have been these like incidents, I'll just call them incidents about cats. And one really important one to me, like when the shit's hitting the fan and things aren't going well, whatever, people, there's egos, there's whatever's involved, client problems, doesn't matter. I find if I take a step back and go, I'm just going to focus on my patient right now, it's always, that's the answer. So that's kind of what my keynote's about. So anyway, I wrote this whole keynote. I was ready to go. And then I completely switched gears and I did stand up at the student, but I have another keynote in like a week.
Oh, you have another one. Oh, wow. So going back to the cat, you need to do that keynote, or at least we need to talk about it per podcast. So I'll definitely put you on the list that we need to get you on with Susan, because we love cats.
Oh yeah, it's about cats.
Right, it's about cats. So, what is the thing that you're doing in a week?
It is like, it's the CVO, but it's not the CVO you think. It is, oh my God. Community veterinary outreach. Sorry, it's confusing because in Ontario, the CVO is like our licensing body. And I thought it was that. There must be so much confusion with me in my keynotes. Anyway, but it's that. So I'm very excited about it.
And so which one of the three are you going to do?
The cats. Because
you're going to do the cat. I like that.
Yes.
I think that's a great idea. I never thought about a keynote about a cat. I could have done that because I do feel that we don't emphasize cats enough. We always talk about, I always say people show when you go to presentations at conferences, it is like the presentation starts and they talk, and it's a 45-minute presentation. They talk 43 minutes about dogs, and then they say, and now we're going to talk about the cat. Yeah. And it's like one slide without any research or anything. And, we're to blame for that ourselves. So that's, what we're trying to fix with the Per podcast, where we talk about cats only. We're not allowed to say the D word. You are allowed to say the F word there, but not the D word.
Okay. Fair.
So just as a, but, talking a little bit of my keynote. So my keynote, I had this grand idea that, I haven't done research in 10 years. So if I look at the other people that do keynotes at VSSO, specifically in this one, which is at Banff, they're all MDs. They're all topics that I don't understand if I read the title. And they're probably all super intelligent, research-based, blah, 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 the latest. And then you have me, which is not going to be intelligent nor research-based. So I said, I need to do something different. And so I decided I'm going to do something completely different. And I'm going to talk about my heroes. So this is a hero.
Yeah, that's perfect. You know what I would say? This is going to sound maybe bad. Those keynotes about research are... I know. You need story. A keynote is story. Like, you need it. So like, I hope they're not boring, but people who just get up and go, this is all the research I did, that will be boring. There was someone at ACVS a few years ago, and he was like, he researched in a human, like in pulmonary infectious disease researcher, hardcore, brilliant. Right. Was like, no one was interested in what he was researching. And then COVID came along and he was just talking about that. He made that boring. Right. Yeah. How is that possible? How? I was like, are you kidding? Like, I couldn't focus on what he was saying because it was like too high level. And I was like, you were in a lab studying like pulmonary, like infectious pulmonary disease. And then COVID came, like, Make that boring. Like that is an amazing skill. But it's because of the lack of story.
Right.
He even had a story, like a story landed in this person's lap. I'm sorry I'm criticized. I don't remember his name. But anyway, I was just kind of struck by how boring you could make that.
And in contrast, at the ECVS 1 year, they had the guy that did full facial reconstructions. Oh my God, that guy was so good.
You know what's so upsetting to me?
What? Oh, you didn't go.
I had a nap. I
You
was
had
jet
a nap.
lagged.
You know,
I was
that
so
is
tired.
kind of the Bryden story. No, I didn't nap while she was doing her keynote, but I had something else and it didn't work out. But yeah, you had a nap during that.
But like so many keynotes are so boring. And I was like,
know.
I'm tired, I'm jet lagged. I went and had a nap. And actually, I don't think I knew it was the first ever face transplant. It didn't really indicate that. It was just, I was like, oh, it was this guy. So I went and had a nap.
Yes.
I came out, all you guys coming out. I'm like, how's the keynote? Whatever. Everyone's like, it changed my life. Like people were like, I see things that I've never seen. It was, it changed the way I think of my whole career. I was like, are you fucking kidding me? I still regret that. It was probably 15 years ago.
Yeah, now when we're together at a conference, I text you, there is a keynote, it's about this topic, and if it's good, come in now.
Yes, we have to do that for each other because you don't know. And I do this at folk festivals, like anywhere I go, like I will always pick the wrong stage. I will pick the wrong talks. Any conference, I'll be like, this looks interesting. It'll be boring. And then the next room over, I can hear people cheering, crying. Like it's a gift. Right. I will also pick the wrong line at a grocery store.
I'm with you there. So when I started thinking, okay, I'm just going to tell stories about people that made a difference for me, suddenly this keynote became much easier because I was like, maybe I can talk a little bit about my previous research. And I'm like, nobody wants it because they've heard, either they've heard it or it is, 10 years old. And then I was like, no, I'm going to talk about these people. And then I also will put some failures in there because I think the failures have formed my life. So it is heroes and failures. That's kind of the big thing. And the more I think about it, the better it becomes. I'm just worried that when I'm there, I don't remember the story that I wanted to tell. Because the one thing that I do really bad is I don't practice. So I know that because what you do with comedy, it takes a lot of practice to hit the right note, the right moments, etc. You went to school for that even.
I did.
And so you practice and practice and practice and even though you might do these sketches and skits already, you are constantly changing things because you see how the public responds, etc. So it takes a lot of work. It is not that you just stand up and start telling jokes and everybody likes it.
Which everyone thinks that it is. And I get bored. Sometimes I get bored. I'm like, I don't want to do the same jokes again or, but it takes, the real skill in stand-up is making people think that you're just, trying to riff, you're riffing and, you didn't tell those jokes ever before. And if people can think that, that's great. But no, like the stand-up specials you watch, the hour-long professional comedians, they've been touring that show for a year, usually.
Yeah, before that, and you can adapt. So for my one keynote, that's not going to happen. And the other thing, I know myself, I am not going to practice. So I am going to. So I changed my tactic a little bit. I'm just going to show a picture. So no text, just a picture. Yeah, so I have to talk to that picture, and then I just go free flow, and it's either going to be completely the bomb. So everybody will be going out of the lecture hall and say, oh my God, what the fuck was this? Or it's going to be completely amazing and everybody say, this was the best keynote I've ever heard.
Awesome.
So it's either of those two.
I think it'll be great. I mean, you don't have to practice word for word, but I would have your beats. We call them beats in the biz.
Yeah, I know.
You're not asking me for advice, but I have your beats.
The issue that I have is we have mid-year reviews and that takes, I am in Sydney and then in Europe and then everywhere. And the night before I will arrive. So I probably am completely jet lagged.
You can work on the plane.
Yeah, that's true. Yeah, I'll talk to myself on the plane and laugh.
You just write out your beats and.
No, it will be good. It will be good. It's just this.
It'll be great.
It is funny because you and I have given so many lectures in our lives. I always get a little nervous just before it happens. And then when I'm there and standing there, it goes. The flow goes. I'm a pretty extrovert, so I know I can see my audience. I can see how they respond to things. I can go on if it hits complete bottom, then I'll go on. I remember the first time I did this is part of my, one of the things that I'm going to talk about, how you fail. So when I was in Georgia, the University of Georgia, I was a intern, and as an intern, you had to do a presentation. And at that time, because I'm going to definitely show people how old I am, at that time, you had slides that you had to pre-make. So you had the little thing that you had to put the letters on, and you had a picture of a dog that someone then took, and then you had to make a slide out of it. So you went to the store to get the slide out of it. And so you had this whole thing with slides, and these were these very modern rotating ones, not the straight ones, but the rotating ones.
Yep.
So I had my whole lecture of 90 minutes 45 to 60 minutes in that rotating thing. And, I had checked it over and over and over, because the problem is if the slide is on the wrong side, this side is upside down or it's inside out. I mean, so everything was checked. Everything was perfect. And I was parking my car, and it was a Toyota Corolla. I remember that. I was parking my car, and I forgot something in the car. And I put the slide thing, the tray, on top of the car. And I was opening the door, and I was grabbing the thing that I needed from my car. And through my eye, I saw the slide thing sliding towards the back of the car, and I tried to grab it while I was sliding down, and then it hit the ground and exploded in this beautiful fountain of slides. The issue was that my lecture was in 50 minutes, because I'm also always either too late or just in time person. So I had to put the slides all back in. So my first lecture was a complete disaster. It was about Cushing's disease. I will never remember. Since then, I hate Cushing's disease, so don't even talk to me about it. The only thing I like to do is rip out adrenals, because it makes me feel a little better. But it was a complete disaster. And then I realized, okay, I probably should either think of myself, I should prepare myself a little better, go a little earlier, etc. All right, so we're almost at that time, because I'm getting a message that we're almost there. Sarah, this was fantastic. One more question: what is the article that made a difference for you?
Okay, well, that was hard. Can I talk about one I wrote and one that I read?
Yes.
Okay, there is.
But you have to be fast, because we might be knocked off.
I really love the initial one about mitotic count in mast cell tumors, because I think it changed how we do. Oh,
we have 9 minutes, by the way. Sorry, we have 9 minutes. Never mind. I just see it on the thing. 9 minutes. Okay. Slow down. It's good. All good.
All right. I'm just looking up the name. Romancic's paper.
The Romancic's paper?
Romancic. See, it's very old now.
Right.
I didn't actually know it was that old. It was the first one to say that we look at mitotic index for prognosis in mast cell tumors.
Oh, wow.
And then the new Kupel system came after that paper.
Right.
And I have a very strong memory. I think I was a fellow. Was I a fellow? Yeah, either a fellow or just done my fellowship. And I saw this at VCS. I saw the abstract of this paper, like it wasn't published yet. And I was like I was so excited about this paper, and we were in the lunch line, getting our lunch, and I went up to this guy.
Yeah.
I really wanted to tell him how much I thought that paper was amazing.
All right.
And I never met anyone who didn't want to talk to me more. He just didn't. He was just like, okay. I was like, no, but that paper. Anyway, so it makes me laugh. I still enjoy the paper, but it also makes me laugh that he just didn't really want to talk to me about it. Maybe he's just having a bad day. Anyway, I still have a deep appreciation for that paper.
Right.
And then I would say, no, it's fine. He's probably a nice guy. Well, he was fine. I mean, I feel bad because he's probably gonna hear this and be like, no. But it was just a weird interaction. When you have those weird interactions that you're just like, well, that was weird. And it was just weird. I just want to tell him this paper was great. Still, almost 20 years later, still feel the same about the paper. Because we kept going, oh, it's a grade 2. No one knew what the hell to do with them, right? So I was like, okay, finally someone is just I like papers that make a change, that make a difference. Obviously, I like the Boston Plasty. And then I think the paper that I am most proud of is the cat mandibulectomy paper.
Right.
Because
a classic.
A classic. Actually, it just came out. They did like the amazing mandible or something in vet surge, and it came back. It made a comeback, that paper, because they were talking about mandibles. Veterinary surgery ran all their mandible papers, and it made the cut. It was just because everyone's like, we can't do that, and I was like, yeah, but you can't. Like, I do, and you can.
Right.
Here's us doing it. And we only got 8. I could only get 8 worldwide. I could only get 8 cases of radical mandibulectomy in cats. And then there's like controversy because there was an equine surgeon who wrote a really like aggressive letter to that surgeon.
Oh, I remember that. Yeah, you got the letter to the editor.
Yeah, and I had to respond to it. And then the funniest thing was at ECVS in Poland, I was sitting there with a really good friend of mine who's an equine surgeon, and then she came over because I didn't know her. She's in ECVS. I didn't know her, and she's very good friends with my friend. And then she came over, she's like, "Oh, I'm so-and-so," and I was like, "Oh yeah, you wrote that letter about my..." Again, amazing. It was amazing. She was so like, she was kind of embarrassed, I was like, well, you did it. I'm a person in the world. Like, you can't just, here I am.
I think she's hello, I'm Sarah Boston.
I think she's Dutch. Yeah, it was really funny. I wasn't a bitch. I just want to make that clear.
Right.
But I also let her know that I knew that she wrote the paper. And I was like, oh yeah, because we were talking about it in my lecture. I was like, yeah, we were talking about your paper or your letter that you wrote.
That's a great story. And talking about papers, another thing that I'm going to say in the keynote is, this is paper season. You know what paper season is?
Oh, because of residents?
Residents need to get the papers in and approved. So I got a request I get a lot of requests to review papers. And I was looking at this request and I was almost pushing the button like, no, I'm not going to do it because we're already busy, and this is just an extra hassle that you had. And then I thought, oh no, it's paper season. This is a resident that needs that paper to be approved in a certain period of time. And I know how busy they are. They have only like 2 years or sometimes 3 years to finish something. It's really, really tough. And then they're hitting that wall of, either rejection, lots of changes, or, manuscripts that take super long. So I said, I'm going to do it. That was my, paper moment. I was like, no, I have to do this. I have to do this one. This person might not be able to do our exam if I don't do this. So,
but then what if you do that and you don't like the paper?
That's, we're not there yet.
But that feels like pressure sometimes when they're like, oh, it's a resident, and then it's like,
but I think you still need to keep your ethical standard.
I know
it's a bad paper. It's a bad paper. I'm not going to accept it. No. But a lot of these papers are not bad, but they just are delayed, or there's reasons why it's not happening. So I am totally in favor of everybody that's listening to this podcast and has already passed their exams, at least accept one paper in the year and during this time. So Sarah, this was wonderful. Thank you so much. I love you so much. You are amazing. I'll get you back for sure. Thanks for sharing your papers. Thanks for sharing your stories about Keynotes and all the other wonderful things you do.
It's so good to see you.
Bye.